Okay, so we're going to be hearing Cynthia Thurlow talking about menopause, hormones, and the microbiome. So another amazing speaker about women's health. It's great. We have so many powerful women on stage today. So Cynthia, she is the founder of the Midlife Pause. She is globally recognized as an expert in perimenopause and menopause and intermittent fasting, a very hot topic. She's also been featured on ABC, Fox 5, KTLA, CW, Medium, Entrepreneur, and The Megyn Kelly Show. So let's put our hands together for Cynthia. Come on up, Cynthia. Great. Take it away.
Thank you. If you had asked me 10 or even 15 years ago that I would be standing on a stage in Miami talking to you about menopause and the gut, I would not have believed it. Much like Dr. Amy Killen, my entire background as a nurse practitioner has been in ER medicine and cardiology. 9 years ago, I grew increasingly disillusioned with writing prescriptions. And so for the past almost 10 years, I've been solely myopically focused on women in middle age because I feel in many ways we are incredibly underserved. And so today we're going to unpack the microbiome. And I promise for every single person in this room, irrespective of what life stage you're in, this is relevant. Does anyone know that until young boys and girls go through puberty, our microbiomes are very similar? So it's actually called the microbiome. And it's after puberty that young women's microbiomes change dramatically in response to estrogen, progesterone, and even a bit of testosterone. We talk about the 3 Ps. We talk about puberty, pregnancy, and perimenopause. And what I find for most of us in this room, we will at least, if we live long enough, we will go through at least 2 of those 3. But each one of these Ps is a time where it is highly dynamic in our bodies. Anyone that's going through perimenopause or has gone through perimenopause will be the first person to say it. The cruel irony is that while your children are going through puberty, you are very likely going through perimenopause, this incredibly dynamic hormonal time. So before we talk about menopause, let's talk about some key stages in a woman's life. We have our peak fertile years, which I like to define before the age of 35. We have perimenopause, which is the 5 to 10 years preceding menopause. And we're starting to see younger and younger women going into perimenopause. And by that, I mean mid to late 30s. And what you oftentimes will hear, if you mention to your doctor, your nurse practitioner, your PA, I'm not sleeping well. I'm having trouble with sleep, especially prior to my menstrual cycle. More anxiety, more depression, more often than not. Many people are not recognizing this as perimenopause. They're just saying you're tired, you're overworked, you need to sleep more, you need to stress less. And then menopause is 12 months without a menstrual cycle. And this is why this is relevant. Over 6,000 women a day go into menopause here in the United States. And that's 1.3 million per year, 47 million worldwide. I just spoke in London, and they were upset that I didn't have specific UK-related statistics, and I had to remind them that I have the worldwide statistics, which are quite incredible. Average age here in the United States is 51. Some women will go through earlier. Some women will go through later. And the number of menopausal women is expected to increase significantly from 467 million in 1990 to 1.2 billion by 2030. This impacts a lot of people. And what's interesting is that, again, with these changes in estrogen, progesterone, and testosterone, our bodies are highly dynamic. And we know that over 50% of women experience gut-related changes, which we'll talk more about, that impact our ability to fight infection. They impact our bone health. They impact when we go into menopause and more. And hormones reshape our ecosystem, the entire microbiome, for our skin, for our lungs, for our gut, our vaginas, our oral microbiome. And all of these changes impact not just physical health, but also emotional and physiologic well-being. And as I always say, meet your microbiome. Our gut is made up of trillions of microbes that work together to digest our food. They help us produce vitamins, and they help regulate immunity. These are just 3 things. There are many things that the microbiome does. And I'm going to make the argument today that the health of our microbiome is critically important. When I worked in cardiology for over 16 years, I saw a lot of older women in the ICU, people who had preventable disease. A lot of it has to do with what's changing in the microbiome and those changes in estrogen, progesterone, and testosterone. Okay, so let's talk about one of the first shifts that's happening in the microbiome. We get less microbial diversity as we are losing these specific hormones. Oftentimes people call them sex hormones, but if I just say it like that, it makes estrogen, progesterone, and testosterone seem irrelevant except to bikini medicine. What's bikini medicine? We think about what's covered by a bikini, right? You know, our genitals and our chest. So we get reduced microbial diversity, which contributes to a loss of resilience, a loss of an ability to fight off infections. We also lose beneficial bacteria, things like bifidobacter, lactobacilli, and we are more likely to get opportunistic infections. This is one of many reasons why, during the pandemic, older patients, especially women, were more susceptible to the side effects of contracting COVID. We know these opportunistic bacteria, fungi, viruses are more likely to create more inflammation and oxidative stress in our bodies. Beneficial bacteria. So as we are losing beneficial bacteria that are being replaced by these less healthy bacteria, as an example, lactobacilli can drop by 50%. This is very important for the gut lining and the integrity, as well as estrogen recycling. We'll talk about all these things in greater detail, and even vaginal health. For many women, not realizing that as we are losing these particular hormones, estrogen in particular, it can impact our susceptibility to urinary tract infections. We're more likely to get at sexually transmitted, they no longer call it diseases, it's called infections, STIs, and other types of painful sex and everything else. The loss of these bacteria has profound effects. We also are impacting our ability to produce short-chain fatty acids. The carnivore community hates being told that fiber is important. I'm the first person to say that I have benefited from a carnivore diet in the setting of being hospitalized and being on 6 weeks of antibiotics. In that context, when someone cannot tolerate fiber, sometimes it's quantity of fiber and sometimes it's a reflection of what's going on in the microbiome. So short-chain fatty acids, examples of these are butyrate, which I'm sure many people have heard of, acetate, propionate. They're actually signaling molecules in the gut that are very important for fueling the gut lining, regulating inflammation, and also supporting our metabolism. Their decline leads to leaky gut. Leaky gut is not just a functional, trendy term. It is actually a real thing. The lining of the small intestine is one cell layer thick. What do you think impacts our ability to fight off infection? That wonderful layer, one cell layer thick. So if you are eating crappy food, hopefully no one in this audience, no one's eating ultra-processed foods or drinking excessively or on antibiotics chronically. There are a lot of things that can disrupt the health of that small intestinal lining. Short-chain fatty acids are critically important for this, and we start producing less of them as we make this transition. There's something called the estrobolome. I always say, I wish they could have come up with a better name. It is awkward. It's talking about how our bodies process estrogen. The estrobolome is where our gut microbes help break down and recycle estrogen. If they are not optimal, guess what? You recycle that estrogen. How many of my patients are technically in menopause, but recirculate estrogen metabolites in their bodies, which drive and worsen symptoms? If you have less estrogen, endogenous estrogen that our body makes, you're less able to recycle the bacteria and you will recirculate more estrogen. And we know that less activity in this part of our gut leads to up to 30% lower estrogen availability. So it's both this balancing act of ensuring, when appropriate, we are utilizing replenishing of hormones, but also understanding that as we are losing hormones, it just makes it harder for our body to properly regulate the estrobolome. And there's a key enzyme called beta-glucuronidase. I know this is a little sciencey, but it's what helps break down that estrogen. And there's ways that we can actually test for it. So big kind of takeaway is it's this Goldilocks effect. We want the right amount of estrogen. We want to be able to process and package it up kind of like a present. I always say we want to wrap the present up and poop it out. That's actually what we're trying to do with the estrobolome. As I mentioned, we're more likely to deal with leaky gut. We know that declining estrogen actually weakens that lining of the gut and leads to more immune system activation. How many of my patients will say to me, I have a lot of bloating. I feel like when I eat certain foods, I just don't feel good. Once that lining has been breached, what will end up happening is you'll leak food particles into your bloodstream. That provokes an inflammatory response. That also can lead to underlying food sensitivities, not allergies, food sensitivities. I think for a lot of people, they don't understand that the brain fog they're experiencing, the joint pain they're experiencing, the bloating they're experiencing can be a direct reflection of what's going on here. And you want to think of this as a coffee filter. Understanding that the filter is there to weed out the things that don't belong, but when the filter's openings are too large, you will start leaking food particles into the bloodstream. And this is why I'm such an enormous fan of elimination diets. Not forever, but just to see what's helpful. And something to consider. There is this bidirectional relationship between our gut and our brain. And I always remind people, if you have a leaky gut, you've got a leaky brain. I'll give you an example. I have a podcast. It's one of my favorite things I do in my business. And I was interviewing Dr. Scott Scher recently. And he was talking about the fact that if certain supplements are given and they're really effective, it's a sign you probably have a leaky brain. So leaky gut, leaky brain, bidirectional relationship. The health of one is interdependent to the other. Leaky gut markers are 2 times higher in menopause versus premenopausal females. This is not conjecture, this is fact. We also get changes in gut motility. How many of my patients will tell me they're constipated? They feel like they just don't process food as well. This is not overt gastroparesis, which is the fancy technical name for when people have a slow gut motility, sometimes related to diabetes. We know the loss of estrogen and progesterone in particular impacts nitric oxide production. Dr. Killen just talked about why nitric oxide is so important for sexual health. I would argue that nitric oxide is critically important for overall health in our bodies, not just the endothelial lining of our blood vessels, for what makes women more susceptible to heart disease as they get older. I saw a lot of it in cardiology, but also it impacts the innervation of our gut. So when patients tell me, I don't feel like I'm able to process food as quickly, I feel like I'm bloated, I feel like I have a stone sitting in my stomach, a lot of that can be directly attributable to the changes that we had, in particular, estrogen and progesterone. This is where women will start talking more about hiatal hernias. They may have more reflux. They may have delayed gastric emptying, in particular with specific types of foods. And the rise in opportunistic infections. What a fun thing, right? There's something called dysbiosis. It's this imbalance of beneficial to non-beneficial bacteria. It's like having weeds in a garden. You've planted beautiful fruits and vegetables, and what grows up in between are the weeds. They can strangle the healthy bacteria. And very, very common to see dysbiosis in conjunction with leaky gut. And the one thing that I think is important for people to understand, all these things can be happening concurrently. It's not as if one happens in a lone issue. It becomes a kind of a cascade or a domino effect. The impact on inflammation. We use that word a lot. Acute inflammation is not bad. Chronic inflammation is. We know that menopause in and of itself can change the gut in ways that increase inflammation, accelerate the aging process, and actually lead to chronic disease risk. And this is where sometimes we will measure markers like cytokines. These are inflammatory particles, interleukin-6, tumor necrosis factor alpha, high sensitivity CRP can all be elevated in the setting of perimenopause and menopause. Remember, I talked about this earlier. There's this distinctive gut-brain axis. What goes on in the gut does not stay in the gut. What goes on in the brain does not stay in the brain. There's a very important nerve called the vagus nerve. This is one of our cranial nerves. It's the longest nerve in the body. It's called the wanderer. Your gut microbiome produces key neurotransmitters, serotonin, dopamine, etc., that impact our mood, sleep, and cognition. And our gut bacteria influence serotonin and mood and sleep by about 60%. A lot of the standard medical care for patients, and there are people that need to be on antidepressants and anti-anxiety agents. I am not dismissing that. But a lot of what we are addressing with antidepressants and anti-anxiety agents are a direct reflection of poor gut health, because that is where the bulk of our neurotransmitters are produced. The health of our gut directly impacts our mental health. When I'm working with patients and one of the first things they're talking about is they're more anxious, they're more depressed, I start thinking immediately about gut health. That doesn't mean that we aren't concurrently addressing it with replacing hormones. That doesn't mean that we might not also prescribe antidepressants. It just means that I help them understand that they are intricately interwoven with one another. The rise in mood disorders in women in middle age is grossly underaddressed. Women are twice as likely as men to suffer from depressive symptoms and disorders. The risk for high depressive symptoms for women is greater during and possibly after the menopausal transition. Remember what I said? There's no shame in needing to take medication to treat depression or anxiety. But many, many women, what they really need is some progesterone. What they really need is to sleep through the night. What they really need is to find effective ways to address stress. And I promise the bulk of our conversation will be about strategies. We know that mood disorders put women at greater risk for other comorbidities. Metabolic health issues, heart disease, diabetes. Heart disease is the number one killer of women. We spend a lot of time educating women, appropriately so, on screening for breast cancer, cervical cancer. I'm the first person to say we need to talk more about heart disease because that is very likely 1 in 3 that will be what kills us. There's also complex interplay between the gut and the bones. I have been having a lot of conversations with bone health experts, mentioning to them, we spend a lot of time talking to women about osteopenia, osteoporosis, and we don't really make the connection for them that the health of our gut has a lot to do with how healthy our bones are. We know that a healthy microbiome helps improve calcium reabsorption and reduces bone breakdown. If you don't know, fun fact, estrogen is one of these bones that helps build bone, and progesterone helps break down bone, but they're very much a Goldilocks effect until we go into menopause. And what happens is, in the setting of lower estrogen, we see more bone breakdown and bone buildup. And that's why estrogen therapy, as an example, is a primary indication for prevention of osteoporosis. So something to just think about. We know that the role of the gut microbiome in bone health is important for bile acids, for how we break down and emulsify fats. It's important for creating pre and probiotics. It's important for, dysbiosis is something that I talked about earlier, about this non-beneficial bacteria that our microbiome is making. It's intricately involved in that. And the more dysbiosis we have, you can tell this with testing, the more inflammation, the more bone breakdown. And short-chain fatty acids, which I talked about earlier, inhibit bone reabsorption. So when we talk about the importance of fiber, I promise you it is beyond just, I have to eat fiber because that's what my doctor told me to do. It really does have a lot of benefits in the body. One thing to just clue everyone into is that women can lose 20% of our bone mass in the first 5 to 7 years of menopause. That's why when we talk about this golden window of opportunity to start hormones, it really is just before menopause or in the first few years of menopause to get the most benefits. Did you know that osteoporosis impacts greater than 50% of women and over 50% of Caucasian women? It's less prevalent in Asian women, African Americans, and Hispanics. And I was just reading yesterday that just based on racial information, that African American women tend to have the strongest bones, just based on research data. Each year, 1.5 million women are impacted by fractures to their hips, wrists, and vertebrae. Wrist fractures are not benign. I have a colleague who's a physician who fell and broke not only her wrist, she also broke several ribs. She is younger than me. I told her, I said, do you understand that a fragility fracture, which is what that is a marker of not only for frailty, but you very likely are at a point where you're losing muscle mass. And we'll talk about why muscle mass is so important. The best screening mechanism we have, and I would argue that every person in this room, irrespective of gender, do not wait until you are 65 to get your bone scan done. A lot of it is dependent on the physician that is reading the report. Number one. Number two, it is inexpensive. Number three, we should be screening women in their 30s because, as an example, when you breastfeed a baby, you are breaking down bone at an accelerated rate. How many women are never told, oh, you breastfed for 5 years? Guess what? You put your bones at risk. That does improve over time. We should not be waiting until a woman is 65. It is a whole lot harder to intervene at 65 than it is at 35, 40, or 50. Okay. The metabolic impact of menopause is catastrophic for metabolic health. The loss of insulin sensitivity is truly catastrophic. The average weight gain in menopause is 1.5 pounds per year. That doesn't sound like a lot, but I'm telling you, over time, that becomes quite a bit, and that is average. What I find is many women don't understand that it is not just the loss of estrogen, which helps with insulin sensitivity, it's the loss of muscle. It's that they're no longer as physically active. They don't manage their stress very well. They don't sleep well. All those things worsen metabolic health. You want to avoid diabetes. You want to avoid insulin resistance like your life depends on it. And I'm not saying that to scare anyone. Every time I use this slide, the looks on people's faces, it is sobering. You do not want to lose insulin sensitivity. Okay. Immune system function, it's not a sexy topic, but it's important just to kind of briefly touch on this. We know that our immune system changes after menopause, again, because of those hormones that we've talked about so many times, makes us more likely to get infections, opportunistic infections. We don't fight infections as well. If we get a vaccine, we probably will not do as well with a vaccine, and that means I'm not anti-vaccine. I'm just bringing attention to what the research suggests. Our gut trains our immune system. If our immune system is changing, then our gut microbiome and our ability to fight infection changes. With menopause, the loss of this microbial balance can make our immune system more reactive, which is why women are more likely to be diagnosed with autoimmune diseases. If you have one autoimmune disease, you're more likely to have others. I had one, I now have 3. They are all stable, but I remind my patients, once you have one, you are more likely to have others. The very reactive nature of our immune system is what protects the fetus when we are pregnant. That's a good thing. But the dark side of that is that it means that as our immune system is kind of ramping down, it exponentially increases our autoimmune risk. How many people in this room have an autoimmune condition? Generally, when I lecture, it is nearly everyone. There are over 100 autoimmune conditions now. It's not just Hashimoto's or rheumatoid arthritis or psoriasis or celiac. There are a lot of things that go on. Recall the 3 Ps that I talked about earlier. We know that the changes in our immune system impact both innate and adaptive immune response. And I'm not going to quiz you on any of this. I just mention it for those that are interested. We know that we get changes in not just progesterone and estrogen, but also leptin, oxytocin. Dr. Amy just talked about that. And prolactin, that interplay between these hormones and between our immune system. This is when I will see women telling me they're never satiated. This is when women will start telling me they have changes or alterations in the foods that they crave. They will find that they are not able to bounce back quite as easily or readily from infections. If they get an infection, it lasts longer. They need antibiotics more frequently. And that is a direct impact of what's changing in the gut. So as I mentioned, with autoimmune diseases, I've read anywhere from 80 to over 100 different ones. It's the 3rd most common category of disease here in the United States, after cancer and cardiovascular disease. I'm going to say that again. It's cardiovascular disease, cancer, and then autoimmune diseases. They are that common. 5 to 8% of our population. And as I mentioned, there are many of them. Some of the more common ones, celiac, Hashimoto's, psoriasis. And it's interesting because I think for a lot of people, they're never told that they have this chronically overactivated immune system. And they're never told if you have one, you are more likely to have others. Okay. I just want to briefly talk about this because I want to spend more time talking and focusing in on the things you can do. Common symptoms: weight loss resistance, gas, bloating, constipation, flatulence, which is meaning you fart, poor sleep, brain fog. Practical solutions, because this is where I want to make sure I spend the most time. I will go into each one of these. I'm going to try my best to hit hormone replacement therapy and peptides. Everyone wants to talk about peptides. It's a hot topic right now. But we will touch on each one of these as quickly as I can. Okay, if we look at the research, we want to eat at least 30 plant varieties per week. I'm not focusing on plant-based. I'm saying plant varieties. That means make a big salad for 10 types of vegetables, fruits, herbs, nuts, seeds into a salad a couple times a week, and you will hit that easily. I'm all about protein. Most of us are not eating enough protein. When I do diet recalls with my patients, guess what? They're eating it a third or half of what they should be eating. We need more protein with age, not less. And that means no less than 100 grams a day. And we'll talk about why I caution people about fasting in a second. Fermented foods are certainly important. Pre and probiotics, we'll talk more about that in a second. Fiber. The carnivore crowd hates when I talk about fiber because they're like, fiber isn't necessary. It's not what the research says. It certainly has not been my sense. More often than not, when people tell me they don't tolerate fiber, it's a direct reflection of the health of their gut microbiome. My husband just finished 6 months of antibiotics. He got tuberculosis. He travels all over the world. Yes, people still get tuberculosis. You better believe he doesn't tolerate a lot of plants right now. And it's because his poor microbiome is working really hard to get back on track. Eating less often. So we will touch on digestive rest, which is the gentler cousin of intermittent fasting. Fiber. Here's the thing. Fiber feeds the colonocytes. They actually feed the cells in the colon. They're very important for restoring diversity. Remember, we talked about how we have these shifts in bacteria. They're very important for short-chain fatty acid production. If you are eating the standard American diet, you're probably eating 5, maybe 10 grams at most of fiber a day. Don't go from that to eating 30. You will hate me. You will be gassy. You will be bloated. You will be miserable. I like people to get it from food-based sources as much as possible as opposed to a supplement. There are good quality supplements that are out there, but realistically, we want to be food-focused. Pre and probiotics. Prebiotics feed the good bacteria. There's lots of examples here. Asparagus, garlic, onions, and probiotics add beneficial species. That's why we have to have probiotics every day. It's not a one and done. It's not you take the supplement or you have, kefir or low sugar kombucha and that does the job. It needs to be a daily effort. Polyphenol-rich foods, all this means brightly pigmented fruits and vegetables. It's important, all those brightly pigmented fruits and vegetables, and I would argue 3 vegetables to 1 fruit, because honestly, Americans really like fruit and they don't like vegetables. So I always say 3 vegetables to 1 fruit. I'm not anti-fruit, although there are people in the health and wellness space that like to fearmonger around fruit. I'm not one of them. Polyphenol-rich foods, why? Because those brightly pigmented hues, the skin that you see, is information that helps modulate the gut microbiome. Intermittent fasting versus digestive rest. There is a topic no more controversial. I never intended to be known for intermittent fasting. I'm grateful, but I always say intermittent fasting used appropriately, and we'll explain what that is, versus digestive rest, which even my teenagers can do. 12 hours of not eating a day is the baseline for everyone. Okay, here's the truth about fasting. It is a hormetic stressor, which means the right amount of stress at the right time. What do most people do? My super type A women. A little bit of fasting is good, more is better. A little bit of exercise is good, more is better. A little bit of carbohydrate restriction, more is better. That is not the message we want to be telling our bodies in middle age. We become less stress resilient. Remember, we've talked about progesterone. Progesterone is this wonderful anti-anxiety hormone. As we have less progesterone, as we become less stress resilient, please don't add more stress to your life. Don't go cold plunge and then go run 15 miles and then intermittent fast for 24 hours, 3 days a week. That is not the way to support your body. I always remind people there's time and a place for intermittent fasting. I still believe in it in a strategy. I just have many patients who do it and do it to an extreme. And, it's like any strategy. When do you use it? When do you not use it? If you can't get 100 grams of protein into your diet, do not intermittent fast. Period. If you're sick, if you're underweight, if you have a latent eating disorder, you have brittle diabetes, you've recently been ill, do not intermittent fast. I'm fasting today because this is how I like to show up when I'm doing a talk, because I have so much mental clarity. Do I fast every day? Absolutely not. Okay, stress. Remember I mentioned loss of progesterone means we are less stress resilient. It's the only hormone that goes up in menopause. How cruel is this? Cortisol is not a bad hormone. It gets a terrible rap. Acute cortisol is great, right? Mine's up right now because I'm talking to you and I'm excited. But if your cortisol is unrelentingly high all the time, guess what? It breaks down your gut lining. It makes you more likely to get sick. It makes you more susceptible to a whole host of metabolic health issues. Cortisol's up, glucose is up, insulin's up, you store fat. End of discussion. If you go through the death of a loved one, you lose a job, you have someone that you're close to that's ill, or there's some other, you've gone through a big move, you have more stress. You have to work on the stress piece to help take care of your health. Stress in the gut. chronic stress, as I mentioned, skews the microbiome towards more inflammatory microbes and increases the likelihood we're going to develop leaky gut and makes us more likely to, insert the blank, more opportunistic infections, more food sensitivities. It becomes a vicious cycle. I think perimenopause can be a wild ride. Many women, I will tell them, things calm down in menopause. Perimenopause can be a wild ride. Sleep. The loss of estrogen and progesterone will impact your sleep. It impacts your circadian biology. It can be worsened by poor gut health. And poor stress management and poor sleep go hand in hand. Show me a woman who tells me she can't sleep through the night, and I show you a woman who's not managing her stress. And that happens for me too. I am not perfect. I wrote a book this year and it was hell, and it's done, and it's going to be great. But writing impacted my sleep because I was constantly thinking. So I had to do extra things to support my health. This is where hormone replacement therapy becomes so important. Whether you choose to take it or not, have an informed decision. But when I look at intake forms, I know who's on HRT, without question. Without question, their sleep quality is superior. And good sleep is regulated by the health of our gut and impacts our blood sugar regulation. If you don't sleep well, you're not going to remain as insulin sensitive. It impacts your digestion. It impacts your metabolism. It all goes hand in hand. And here's the other thing. You don't sleep well, you're not going to build muscle. Your gut makes precursors like tryptophan and serotonin for melatonin. Melatonin goes down with age, right? I'm not anti-melatonin. In fact, I take it every day. Gut health affects our circadian rhythm. It impacts how cortisol is distributed throughout the day. It impacts whether or not you have night sweats. It impacts your sleep quality. Women with the lowest gut diversity are 40% more likely to have insomnia and menopause. This is completely modifiable with diet and lifestyle and a touch of HRT. Exercise. All right, I've got 11 minutes. I'm going to try to get through these slides and make sure I have time for a couple questions. Exercise. It's the Goldilocks effect. Right exercise in the right amount. Ladies, this is not the time to suddenly, you want to go run an Ironman. No. That is not what I'm referring to. We want to lift weights. We want to use targeted high-intensity interval training. That is not for 30 minutes. That is short duration, intensity, short duration. The important is zone 2 training. I live in a very hilly part of Virginia, and I can get zone 2 training in just walking my dogs. But incorporating zone 2 training, all are important, and the research certainly supports this for each one of these. We know the research suggests that exercise has potent anti-inflammatory benefits. It shifts diversity in positive ways, provided that it's the right intensity. Remember I said, and I don't mean to pick on CrossFit, but I'm going to use CrossFit, super intense. Orange Theory Fitness, very intense. Running a marathon, very intense. It impacts the health of our microbiome. You get a transient leaky gut if you work out intensely enough, but that should recover. Again, it's the Goldilocks effect. Supplements. I'm going to talk about each one of these, so I'm just going to kind of move forward. Urolithin A. This is a postbiotic. It improves the tight junctions of the small intestine. It helps support that mucus layer. Now, smart patients of mine will say, well, I know I can get urolithin A from pomegranates and strawberries. I'm like, yes, but yes, you'd have to eat a lot of those foods. And number 2, it's dependent on your gut microbiome. Urolithin A is a game changer. It reduces inflammation. It upregulates mitophagy, which is getting rid of disordered and diseased mitochondria. And as I stated, the health of your microbiome determines whether or not you can actually produce enough urolithin A. Anywhere from 500 milligrams to a gram a day. My husband takes a gram because, again, as I mentioned, he was on antibiotics for 6 months appropriately. Butyrate, primary fuel for the colonocytes via short-chain fatty acids. We make less of this with age, and they're very important for healing and fortifying the tight junctions and intestinal strength. They also reduce inflammation. They also support our immune system. They may lower our heart disease risk and help with osteoanabolism of bone, so creating bone. We want to get them from fiber, resistant starches, and polyphenols, as I mentioned, brightly pigmented fruits and vegetables. In some instances, dairy, if you tolerate dairy. A lot of women in menopause and perimenopause do not. There are options for supplementation. Again, if you can't get it from food, get it from the supplement. TUDCA, one of my favorite supplements. It reinforces tight junctions. This is a supplement along with urolithin A that I would say without question I'm using with almost all of my patients. Reduces inflammation, improves insulin sensitivity. It helps emulsify and break down bile. Bile is what's important for breaking down fat. It supports healthy mitochondria and the gut-brain axis. And I would say start with 250 to 500 milligrams. Some patients, if they start really high, can get a little bit of loose stools. And there's solid research on each one of these. Okay. Creatine monohydrate, again, foundational supplement. You can't get enough from eating steak. We need more as women. We get fluctuations throughout our menstrual cycle. There's a lot of research coming out that creatine is important for bone health, brain health, jet lag, strength, all very important. And here's the thing, little fun fact. What precedes muscle loss is a loss of strength. So if you're finding it's harder for you to do things, open up that jar of pickles, picking things up, that's a clue that you need to be doing more strength training. We know creatine is helpful for inflammation. Again, foundational quality is important. I'm going to just plug this here. There is a company in Germany. It's called CreaPure. That is the purest type of creatine monohydrate. Do not believe the crap that's out there. There's a lot of stuff that's cheap that's made in China. I'm always the first person to tell people CreaPure is what you want. You're less likely to get gut symptoms. Some people say I get bloated. I don't feel good. It's from the cheap stuff that's acid washed. Okay, hormone replacement therapy without question. Everyone knows about estrogen, progesterone, testosterone. Not everyone needs testosterone. About 25% of women are fortunate enough that they don't. I'm not one of them. DHEA can be very important. Pregnenolone, very important memory hormone. Everyone needs their pregnenolone checked. You want it greater than 50. There's my pearl. All of my patients almost all of them take pregnenolone. Estrogen in the gut microbiome, we know, as I mentioned earlier, and I try to be really sensitive to the fact that I only have 6 minutes left. Estrogen in the gut microbiome are like peanut butter and jelly. As you're losing estrogen, you are losing your ability to have a healthy microbiome. We know that those that are using HRT, we know they have a healthier microbial diversity, more insulin sensitivity, and less leaky gut. All right, this is just some research. I'm going to skip through this. Peptides are hot right now. Everyone wants to talk about peptides. GLP-1s, everyone in this room probably is familiar with tirzepatide, semaglutide, whether you are taking it for an indication of weight loss, whether you are taking it because you have high blood pressure or diabetes. I'm seeing a lot of microdosing or personalized dosing of GLP-1s for the autoimmune piece, for the inflammation piece. They're using teeny tiny doses. That means a tenth or even a quarter of the normal dose. It is not designed to lose weight. GLP-1s are going to change the landscape. We're looking at research now on heart disease, autoimmune conditions. I think that we will probably find an indication for just about everything and everyone. Thymosin alpha. Remember we talked about how the immune system takes a hit in menopause. Thymosin alpha 1 is a particular peptide that's really beneficial. You want these things compounded. Please don't go on Amazon and find, the place that sells stuff from China. You don't know what you're getting. BPC 157 literally hits everything. You can take it orally. If you're having joint issues, you can have it injected into the joint. That's more of a regenerative medicine type space. The BPC 157 is certainly a favorite. This is not an exhaustive list, but these are the things that more often than not I'm talking to my patients about and made a big difference. Boy, I wish I had another 15 minutes, but I don't. The biggest thing to take away from this is all personalized medicine. Talking to your provider, these are compounded medications. This is not stuff that you're finding over the counter. If someone is telling you that they have an oral GLP-1 drug that's out there, there is one prescription drug. If there's anything else that they're out there, they're trying to tell you, like, you're going to take this supplement and it's going to mimic. There's very little. There's one company I can think of in particular. Beyond that, the research just isn't there yet. BPC 157, big picture is everything is modifiable. Like, taking away from this lecture, everything that I'm talking about are things that we can change proactively. Most of it is lifestyle. A lot of it is working concurrently with providers that are going to be able to honor your wants, needs, and desires. I didn't even get to anabolic steroids. There's a whole other, we can unpack that for quite a while. We know the microbiome is completely malleable. It can change in days with the right inputs, and small steps can lead to better health and diversity. This is me. This is my book, The Menopause Gut, which will be out in 2026, but is on sale now. This is how you can follow me. I have a wonderful podcast. I'm just getting started on Substack. Dr. Amy Killen has given me a lot of encouragement to get started there because it's a great way to learn more about what's going on in my brain. But thank you again. It's been a pleasure.